That started at 8:30, and we had a great amount of information shared about all of our different departments, our different programs that are going on to really support our community. I urge you to go to ventura.org/BOS to view that meeting at any time in case you have any other questions. Today, we will be talking about our health care. We will be talking about public health in our sheriff's office. And on behalf of the Board of Supervisors, I would like to thank all of you for staying well at home and following those ordinances. One thing my office and many of our offices have been asked is about the masks. I wanted to mention again, we have cloth masks that are there. You could wear easily to go to the grocery store, go out for a walk, anywhere you're going to be talking with community, or not talking with communities, but out about and not at home. These are easy to wear, and also you need to wash them every day. I just want to make sure so that the germs are clean. If you're wearing gloves, make sure that when you take them off, you put them inside out, put them in the trash can, not on the floor, and then also make sure you're washing your hands. The 20 seconds is extremely important, no matter if you have gloves, masks, or anything. That's the key to not spreading germs. We'll be hitting that more today, I'm sure, but I will now start with our lineup for today's update. We have Roberto Vargas, our Director of Ventura County Public Health Department. Then Sheriff Bill Ayub, our Ventura County Sheriff's Office. Dr. John Frankhauser, our CEO for Ventura County Medical Center and Santa Paula Hospital. Dr. Teresa Cho, our CEO of Ventura County Ambulatory Care. And then to follow up will be Mike Powers, our CEO, Ventura County Office. Thank you again for watching today. I urge you, if you miss any point of this, to go to vcemergency.com for our latest information. We will have these updates every day at 1 o'clock, and then also on Tuesdays. Make sure to watch our Board of Supervisors meetings for all the information on a weekly manner. Thank you very much, and I will pass this on to Rigo Vargas. Thank you.
Good afternoon, Ventura County residents, and thank you, Supervisor Long. So, again, my name is Rigo Vargas. I'm your Public Health Director in Ventura County. So today I have an update on our numbers, and then say a few comments regarding National Public Health Week that is currently in place, and then also turn it over to our next speaker. First of all, our numbers keep on increasing. We've had 17 new cases of coronavirus in Ventura County. Later this afternoon, we will be reporting the details of all 243 cases of positive coronavirus in Ventura County. It's important to note that while this is a very serious health issue, people are recovering, and so we will be reporting that 89 people have recovered from coronavirus. That means that after 14 days, they are no longer symptomatic. Unfortunately, this is a deadly disease, as we know. And while we're still at 6 deaths in Ventura County, each of those deaths is one too many. And our hearts and prayers go out with those families. Our thoughts and prayers are also with many individuals that are in the hospital. We've had about 45 of these 243 positive individuals in our hospitals at any one time. And we are hoping for a recovery for them as well. Soon we'll be reporting also those that are in the intensive care unit at the hospitals. This will be one indicator of how our hospitals are doing with regard to increased patient load. To date, about 4,300 residents of Ventura County have been tested. So while that number is also increasing, clearly there's a lot more people out there in Ventura County that are positive. And so for that reason, we continue to urge the public and businesses, every resident in Ventura County, just as every resident in the state of California, to stay indoors as much as possible. Our order is stay well at home, and we mean it that way. Stay safe and stay well and stay at home. These are crucial times. We expect that the surge or an increase in hospitalizations will begin to occur next week or within the next couple of weeks. So this is still very crucial time. I can just imagine how difficult it is for our seniors, for our children, our youth, to especially be indoors, and especially those that may not have a backyard or a front yard or a park nearby. It's very difficult. And also our seniors, many of them are isolated, even though efforts are being made to visit them. Those essential care workers are visiting them or making checks on them, but it's still very difficult. But again, we're at a crucial time, and we need to stay we need to stay home. I mentioned that this is National Public Health Week. Usually the first week of April, I come before the Board of Supervisors and give an update on Ventura County Public Health's efforts to protect and promote the health of our community. Clearly, we're in a time that is very challenging for all responders into this effort. We have our brave, courageous, awesome first responders and healthcare workers, our nurses, our doctors, and all the personnel in the hospitals caring for these 45 individuals that have been in our hospital so far, and many more are expected to come into our hospital, and we have these mighty and brave, courageous individuals treating for them. But I'd like to, again, just take this opportunity to thank all those in my department, the public health professionals that day in and day out work to protect and promote the health of our community. Many of you may not know, but our public health department is made up of approximately 350 dedicated also public health professionals. We're made up of doctors, public health nurses, public health lab specialists, EMS, emergency medical services specialists, health educators, social workers, nutritionists, outreach workers, administrators, of course, and support staff in HR and fiscal. So all those public health professionals I really thank for working hard behind the scenes and on the front lines with regard to this response. I'm very appreciative of their efforts, as I am of all county family and our community partners that are working so hard to protect the community in these difficult times. And with mentioning protecting our community, next I would like to call our Ventura County Sheriff, Bill Ayu.
Well, thank you, Mr. Vargas, and good afternoon, everyone. Pleasure to be here with you this afternoon. Wanted to give you a little bit of an update on what's going on public safety-wise in Ventura County. We continue to focus on an educational approach in our efforts to ensure compliance with our public health orders. I think we all know what the spirit of those health orders are. There's some complexity to them, and our deputies work pretty consistently and pretty steadily at trying to filter out some of those complexities for our public. Many people don't simply understand. We spend time explaining the health orders, the purpose of them, and trying to gain compliance. And when we look at public safety in our community, we look at it from sort of a global perspective. We want to make sure people understand what's required of them. These are extraordinary times, extraordinary orders for the public to adhere to. Things that are normally part of our everyday routine are suddenly unlawful. And we want people to comply voluntarily. We don't want to be in a position where we're having to use enforcement measures to force compliance on people. We simply cannot do our job without the public's guarantee of it making sure these orders are adhered to. It's virtually impossible, so we need the public support. But in addition to education, we look at engineering. And as one example, we recently closed beaches. We saw a lot of congregating and loitering on our beaches. It posed a health problem, which is contrary to the public health order's spirit. And so it's virtually impossible to clear out 55 miles of beach line with a handful of police officers and deputy sheriffs in our community. And they have plenty of other things to do as well. So we worked with our partners at Caltrans, with our General Services Agency, and we posted no parking along many of our beach access areas, in addition to closing beach parking areas. This helps us greatly with shooing folks that just want to enjoy the beach, but unfortunately can't because of the closure orders. away and allows us to do our job more efficiently and more effectively. And that's an example of engineering that we use to problem solve throughout our community. Sort of as a last resort is the enforcement piece. And unfortunately, those other two components, education and engineering, have been exhausted in some situations, and we're at the point of enforcement. And there are steps being taken for problematic businesses and certain locations throughout the community that we're working on enforcement measures now. It can be a slow process. There's not always an immediate gratification of results from those enforcement measures, but it's just yet another way we have in which to gain compliance and assure the safety of members of our community as we move through this very difficult time. You may see our deputies out in the community wearing personal protective equipment a little more frequently. With the intensity of the pandemic increasing locally, we're nearing our apex of illness in our community, at least what we believe that is. Our deputies may have personal protective equipment in the form of eye protection, particle masks, and gloves as they're working throughout the community. I am sad to report that one of our deputy sheriffs has tested positive for the COVID-19 infection. That deputy became symptomatic on days off from work and was tested and received positive results and has been away from work since those results and since those symptoms took their onset. The deputy is doing well and resting comfortably at home, and we're taking steps to ensure that our workplace is safe and that those entrusted to our care and our inmate populations remain safe as well. So thank you for your time. Next is my pleasure to introduce Dr. Fankhauser for an update from the Ventura County Medical Center.
Thank you, Sheriff. I appreciate the chance to talk to you all about what's going on at your county hospitals, Ventura County Medical Center and Santa Paula Hospital. I greet you on behalf of the healthcare workers there. We are continuing to spend an enormous amount of time preparing for a COVID-19 surge in patients, as well as protecting our staff so they don't get infected. We have a lot of efforts directed towards continuing to protect ourselves with adequate PPE. We've located multiple sources and have identified alternatives. There's a group of people in the community who are helping us with masks and with gowns. We have a local distiller who's redirected their business, Ventura Spirits, redirected their business to creating hand sanitizer for us in large quantities. And it's really been a tremendous community effort and partnership effort that has brought out the best in our Ventura County. As we look towards protecting our staff, it really goes beyond PPE. There's a lot of procedures and processes that we're refining in order to keep our folks safe. As you know, in order to care for those in our community, our staff have to be able to keep themselves healthy. Some of that includes staying away from their families, either because of an exposure or because they live with family members who fall into a high-risk category. We've worked with a local partner to create 12 rooms in our hospital for people to stay in temporarily. We've also partnered with Kirby Auto Center and Kirby Barber RV to bring RVs into the parking lot at VCMC and Santa Paula Hospital, where staff can stay for a little bit longer, those who are monitoring their own symptoms and checking their own temperatures. In addition, the Family Justice Center has opened up a portion of their facility, which will provide us with 6 more rooms. And we're beginning to distribute scrubs for people to wear at work so they can come to work, change into surgical scrubs, and then change back into their clothing when they go home, in an effort to not only protect our staff but also protect their families. We've changed a lot of processes in the operating room, really trying to prevent people in a risk, in a setting in which patients are put on a ventilator, and we know that the virus can be aerosolized in that setting. And we've changed how we're managing those cases. Fortunately, we really recently received the Cepheid Gene Expert cartridge for rapid diagnosis of COVID-19. And so we do have a test on hand in limited quantities in which we can get a result back in about 2 hours. And that's going to allow us to identify those patients in our hospital who are really in the highest category of protection for our staff. We continue to work on our surge plan, trying to expand the number of beds available in our hospital, recognizing that other places and other parts of the country are completely overwhelmed with patients, and we have the capacity to flex up almost 100%, almost doubling our bed capacity. And we're looking at ways to expand our staff. We've started some training programs for our nurses in ventilator management, recognizing that if we have to expand our use of ventilators, then there will have to be additional staff in order to manage those patients. In addition, we're looking at, there's a form of ventilation where patients are put on their abdomen to ventilate them, and we're training our physicians in that ventilator modality, and those efforts continue to go on. We are looking at medications. As you know, it's a brand new disease. We're not exactly sure how to treat it and what is effective, but there's some very hopeful treatments, including hydroxychloroquine, a medicine that's traditionally been used for malaria and for autoimmune disease, as well as another antibiotic, and the serum from people who've come through this disease and recovered from the disease, and looking at those modalities and what it would mean to incorporate those into the treatment regimen. I just want to take 1 minute to address, on behalf of the healthcare workers, our community. You know that people are coming to work. I get emails of people who are afraid. I got an email this weekend from someone who said, you know, I just want to be assured that if I fall sick, you'll care for me, and if I don't make it, you'll reach out to my family. And that's the sentiment that our staff are dealing with every day. There are people coming to work who've left their families. Some of our nurses are staying together in a home. Some of our nurses have left their children with family members. And our healthcare workers are really laying it on the line for you and for our community. And on their behalf, I just want to express our deepest gratitude for those of you who are making personal sacrifices in order to stay home and stay safe. It's really heartening to see the community coming together. I know April is a special month for those in multiple faith communities. I know it's a month of Palm Sunday, of Easter, of Passover, and of Ramadan, and a time where faith communities tend to gather together. And it's my honor to just say thank you to you all for the innovative ways that you've addressed worship, the ways that you've decided, instead of coming together in the same space, to come together electronically. And I just, despite the high-profile church that was represented in the media this weekend, what I see is just a tremendous number of people of faith who are taking seriously the call to consider others better than yourself, and to consider others' needs above your own. And on behalf of the healthcare workers who are risking their lives every day, I just want to say thank you. With that, I am happy to introduce my colleague, Dr. Teresa Cho, the CEO of our ambulatory care system.
Good afternoon. I want to reiterate gratitude for all of the healthcare workers in the county who have put the needs of our community before their own. We are also fearful, and we're using that fear and energy and knowledge to truly get ourselves ready for what we think will be a surge in the coming weeks. And that is despite the struggle with having enough personal protective equipment, with having enough testing kits, and still not knowing as much about this virus as we would like to know. I want to remind the community that there are many in the community who may be asymptomatic carriers of this disease, which means that you could go to the grocery store or a big box store and that person might be next to you and not even know it. You might go to a party and give a hug to a friend and actually be exposed to COVID without that person or you knowing it. And just being within 6 feet puts you at greater risk. So I just want to remind everyone to obey the order to stay 6 feet away from people who are not part of your nuclear family. The greatest concern, of course, is for the patients who will get sick enough to have to be hospitalized. We want to make sure that we can meet the needs of the community, and so it's important that we don't all get sick at once. And that's why even though the social distancing seems to be helping us here in California, we really can't let up on our efforts that you have made so many sacrifices already to make. So I just want to explain that in places like New York City, they have so many patients that they don't have enough ventilators for those patients. And that's not typically something that we as American doctors have to make a choice of, like who gets a ventilator and who doesn't. So I don't want to have to make that choice here. And for that reason, really ask that everybody obey the stay-at-home orders. I know this is a hard sacrifice. It's a big change for all of us to adjust to this lifestyle. It gets boring and, there's not a lot to do at home sometimes. I know your children are at home bored or trying to get used to online classes. But again, I just want to reiterate, we can get through this if we do this together. Please spend time with your families. When you go on walks with your families, please do so just with the people who live with you and avoid contact with anybody else. Please take other opportunities to stay in touch with your friends and family, whether it's by phone or by Skype or FaceTime. But otherwise, please enjoy your time with the family that you have at home. Thank you. It's my honor now to present our last speaker, Mr. Mike Powers, who is our County Executive Officer.
Thank you, Dr. Cho, and good afternoon, Ventura County community. And on behalf of our Board of Supervisors, I just want to first say thank you. As we've heard from our public health officer this morning and our sheriff today, you are complying with the Stay Well at Home order, and it's making a difference. And I think it's so important because when we think about this time right now, and in the coming weeks, we're going to look back at these days at some point and reflect and think about how we did and think about all the sacrifices, the schools and businesses closing, the first responders taking risk for us, the healthcare providers that you just heard about who are taking risks so that they can take care of us. And then we can look back and feel so good that we were able to flatten that curve, to stop the spread and prevent that surge. Just think how good we'll feel. The solace that this community will have that each and every one of us contributed to saving lives in our community. So we thank you for doing that. I also wanted to update you too on a couple of big areas that we hear a lot about. That's personal protective equipment, PPE, and hospital surge capacity and the preparations there. Just want to let you know that there's a real organized effort that's led by our Emergency Medical Services Agency, which is a Department of Public Health in the county, Steve Carroll. And they are overseeing all of the acquisition efforts to get PPE from federal stockpiles, state, private business, local donations. And it's not just random. They have specifications that they put out. So they make sure the quality of the donations that they get and all of the equipment that they get, and they have a plan in place for how they allocate it to those most in need in terms of hospitals, nursing homes, physician offices, and so forth. And they even had the foresight several years ago to develop its own stockpile of ventilators. So in addition to the ones that we have now in the hospitals, they have over 50 additional ventilators that they're putting into use right now. And then our hospital surge capacity. So I have the privilege of sitting in on these calls where they coordinate the surge planning EMS does with all of the hospitals in the county, public and private. And I can tell you it's very reassuring. Their goal is to essentially double their capacity to get to 1,100 or 1,200 more beds. Well, they've already established capacity for 800 more beds. So they're already more than 2/3 of the way there, which is remarkable. And they're canceling their elective surgeries. And that's a big sacrifice for them because it's a big financial sacrifice. But they know it's the right thing to do. They're doing it. It builds capacity, and it also saves personal protective equipment for the surge that may come. Other things that they're doing include more and more testing. We've heard public health's doing, private labs are doing it, but hospitals are now, as you heard Dr. Fankhauser mention, they're doing some of their own testing, so they're helping to build that capacity. Innovative treatments. There are also some hospitals now that are taking plasma from recovered patients and using that on COVID patients, and they're seeing good results from that. And I think it's important that we talk about the positive piece too. We see the numbers, testing numbers are going up, and there's more positive, but there's also more recovered, and we're watching that number. 64 individuals in our community already so far have recovered from COVID, and that's a really important piece. The other point I want to share with you, and they're a modest bunch and they won't share it with you, but I've heard it and seen it, is that the hospitals are sharing amongst each other. When one is short, whether it's staffing, materials, equipment, whatever it is, the other steps up and vice versa. They're keeping focused on what's in the best interest of the community and their patients. And they're also keeping focused on making sure that all of their health care providers have the personal protective equipment and all of the resources and staffing they need to take care of us in our moment of need. So it's a wonderful process, as I say. Credit to the hospitals and credit to EMS and all of our healthcare providers. And so with that, I would just continue to say thank you, Ventura. Continue to stay connected. We will see, and stay tuned. We will see you here tomorrow at 1 o'clock. And stay connected with us on vcemergency.com. And just remember, when it comes to staying apart, we've got to stick together. So thank you, and stay well.